Thank you everyone for joining us for today's HTRC Education Series session. I do have just a few notes for you prior to beginning our session today. As a reminder, it is being recorded and we'll share it with you afterwards. Please use the chat to ask questions as we tend to have a large group during our sessions. Also note, we will get to the questions at the end of the presentation. If we do not have time to answer it during the presentation, as part of our practice, we will note it and we will get Dr. Besovic to answer, and then we will provide it as a follow-up handout and resource. If you would like a completion certificate, please contact us at htrc@kumc.edu. We will put that email in the chat. Be sure to include your full name as you would like it to appear on the certificate. We have a lot of information to share today, so questions will be monitored in the chat, as I said, and we will provide them in the follow-up email if needed. So let's get started. I'd like to introduce our speaker, Dr. Mirna Besovic. Dr. Besovic is a health informaticist at University of Missouri School of Medicine, Department of Dermatology, and core faculty at MU Institute for Data Science and Informatics. Her research is focused on telemedicine and telehealth and the role of virtual care in improving key patient outcomes, in particular using telehealth technologies to improve access to care for rural patients. Dr. Besovic is the lead project evaluator for the Show Me Echo project and is the 2024 recipient of the MU Gold Chalk Award from the Graduate Professional Council and 2021 recipient of the Ann K. Covington Award from the MU Fellowship Office. She was honored as a MU Top Faculty Achiever in 2017 at the event recognizing faculty who have received prestigious awards and grants. Her work has been funded by NIH, NSF for Health. Well, Dr. Besovic.
Thank you so much for that introduction. I don't recognize that person, but thank you. Let me share my screen. I think I'm sharing. Do you see the slide or the speaker slide?
It looks like it's on the speaker slide right now.
Okay, let me try that again. Is that better?
Yes, I can see it now. Perfect.
Okay, perfect. Thank you so much. Thank you for inviting me to speak about data sharing in ECHO and the importance of data sharing in ECHO. I'm really passionate about this topic. I see a few of my colleagues from the Show Me ECHO on this call, and they know how much I talk about the importance of bigger data sets, having access to bigger data sets so we can really show true outcomes in ECHO. So my presentation today is really structured around three main topics. I am going to talk about the importance of ECHO data sharing. I'll talk a little bit about current practices, which isn't much about data sharing across different hubs. There are many challenges, I'll address those, and then I will talk about how can we tap into machine learning and AI, specifically into federated learning frameworks as an opportunity to share data across different ECHOs. I think that I don't need to talk a lot about ECHO. I believe everybody on this call knows, but just as a reminder, Project ECHO's Extension for Community Healthcare Outcomes is a provider-to-provider telehealth. It's a platform that uses Zoom, kind of like what we're doing today, to provide tele-mentoring and education to primary care clinicians. It's primarily used to increase capacity of primary care clinicians practicing in rural and isolated areas. What I really like about ECHO is that it's a knowledge sharing network that has a tagline, all teach, all learn. So even though the hub team specialists are the ones that typically mentor primary care providers, everybody on those ECHO calls is encouraged to share their knowledge and experiences, and everybody learns from that. And ECHO really is a very data-rich environment. There is so much data that is being shared in every ECHO session. And for those of you that participate in echoes, you know that each echo session is also recorded. So there's a lot of data sitting in recorded echo sessions as well that we could tap into. So what types of data are collected in echo? There's clinical and non-clinical data, of course, but the richest data is in case presentations. And case presentation data is in case presentation forms that are submitted typically before echo session, in hub team recommendations as well, and then during case discussions, any data that is collected is also being recorded. I will say that Durham Echo also collects images, but I'm sure that's not the only echo. It's just the one that I'm familiar that comes right top of my head right now, that has really good images as well. These are all de-identified images. We have access to session attendance, and session attendance data will provide information on the participant type, such as MD, PhD, DO, PA, nurses, learners, those who are observing sessions, and so on. We can look at their attendance over time. We can look to see who's presenting cases, how often, what types of cases are being presented by each individual provider. Another type of data that's collected is CME and CNE data, CE data. So this is continuing medical education and continuing education as well, and survey responses. Now, these survey responses or survey data varies greatly across different hubs, because there are different types of surveys that's typically collected. But one that I see a consistent across most hubs is satisfaction surveys and surveys that collect information about topics of interest. So like I mentioned earlier, clinical data and case data really contains very rich information that could help improve both echo project evaluation and also research. And I use just some examples from studies that we've published in the past, but there's a lot of other information in published literature on clinical echo data. Like I said, diagnosis and treatment data is collected. We can look at decision-making pathways. And what I mean by this, the recorded echo data also contains information about diagnostic accuracy. So we can look and see the provisional diagnosis by PCP, match it with the final diagnosis by the specialty hub team, and then look over time, how is diagnostic accuracy changing or improving over time, maybe with different types of clinicians or different types of echoes, or even different across different sites. And also follow-up data. For example, in the images that I selected from one of our previous publications, we see the initial image that was submitted during the first case discussion. And then the hub team invited the presenter to come back and present the case again after the follow-up visit. And we have a picture of when the condition improved, I think a couple of months ago. There is also very rich educational data collected in ECHO, and some of this is published, but I believe that a lot of this data is really stored within each different ECHO hubs and hasn't been published yet. Some echoes collect pre and post knowledge assessments. Some ask, like I said, for topic preferences, and this is an example of a study that specifically addressing topic preferences, and also participant feedback, such as satisfaction with echo as a whole or a particular echo that was attended. So this is where, all of this becomes really interesting. So what are the collection tools used to collect all of this rich data? It's sort of all over the place. And some of this I took from the literature, and some of this I know we use at the Show Me Echo. And I will say that the collection tools have changed over time, because ECHO existed for 20 years now, and we have used it at the University of Missouri for over 10 years, 7 years now. So we have changed practices as well, but I see a lot of REDCap used for survey collections. We use Zoom reports on attendance. I also use Zoom transcripts to look at the data. We use Salesforce. I'm not an expert in this. I have, if there are questions about Salesforce, I have colleagues on the call who can probably answer that question better than I can. There's also a number of observational checklists. So we have clinical liaisons that attend echo sessions, and they periodically complete observational checklists, which are typically Word or PDF, and then need to be entered in Excel later on. And Excel is used across the board for different types of data collection. So like I said, some of this is done automatically, some of this is done manually. There are different survey instruments done in different ways. And I don't see a lot of consistency across hubs on how different data is collected. So what are some gaps in data collection? And I really, so the inconsistent metrics is not even so much of an issue. I think that the fact that we have changed the collection practices over time, and this is not something that ECHO necessarily is concerned about, but me as a researcher and somebody who's looking at the data, this is really important. Longitudinal data is really important to me. And so when I want to pull our own ECHO data, if I'm looking at case data, initially we have probably 6-7 years worth of case data in PDF forms because that's how we were collecting it before, and now it's automated reports. So getting longitudinal data can be done, but it's a little bit more time consuming and it would need a little bit more resources. So I see that as a smaller issue and a current gap, but something that we can definitely look at. So the need for ECHO data sharing comes from, being able to access a bigger data set than operating in our own little silos. And so this can help us all scale learning about ECHO. It can help us understand impact of ECHO on learning outcomes, patient outcomes, answer specific research questions. It can facilitate research and collaboration across different hubs. So what I mean by data sharing is I just wanted to go through examples. For example, in dermatology ECHO, having access to more images, having access to more de-identified patient cases would help us understand maybe how diagnostic accuracy changes over time. It could help us identify trends in misdiagnosis of rare conditions better. It could improve consistency recommendations of hubs for skin cancer screening for high-risk patients. It could also help us enable benchmarking of clinician learning across different hubs and facilitate collaborative research on tele-mentoring outcomes. So if we had access to bigger data sets and share data across ECHO hubs, we could use it to improve our curriculum, for example. A lot of participants, like I said, submit their satisfaction surveys or send or even discuss it during ECHO sessions about the particular need for particular topics, or even if we just look at the type of cases they're bringing and presenting in ECHO, that would help us identify the learning needs of those participants, and we could improve our curriculums. It could help with research publications and collaboration across different hubs. It could help with grant applications, identify best practices, track educational outcomes, and really drive quality improvement in ECHO. But there are a lot of barriers to centralized data sharing, and think about EMR access. Okay, so that's sort of, I'm drawing a parallel here because it can be done, it's being done, but we all know the resources that need to go if you need access to EMR of a different institution, right? It's really something that what we're proposing here with federated learning, we can overcome this huge barrier if we just apply new frameworks, right? And so there are a lot of privacy concerns. So there's no PHI discussed in ECHO. However, provider information is in every recording, provider information is in case forms. We also know the hub team information, right? So there is still privacy concerns in ECHO data. There's lack of interoperability between sites, and we still operate in silos. So building a national repository would be great, right? But I don't think it's really feasible. It would require so much to build a secure platform. We would need to have collaborative agreements. Metadata tagging would take time, and then where would it be stored and who would have access and how? So what we're proposing with this framework is federated learning, and this is a machine learning and AI technique that actually is not sharing any raw data. And so in the framework that you can see on this image, you see that your traditional cloud data sharing, where each side sends their raw data into this centralized system that then analyzes the data. But with federated learning, we would train data in each hub to pull the data, analyze the data, and only share aggregated data with the centralized hub. So there is no raw data sharing, and there is no PHI or even provider data that's being shared. So that's the huge benefit and opportunity that we see with the federated learning. So why would we use it in ECHO? Well, we would use it because this machine learning model can learn from different distributed data sets without requiring the data to ever leave the institution. So this would preserve privacy and institutional autonomy of their data. And so this is the framework that we built for a poster that was presented at the Surge conference. I think this was February this year. But I didn't realize this until I started to put this presentation together this week, that actually looking at the framework that we built to propose how to use federated learning in ECHO, that this actually mimics ECHO perfectly. And funnily enough, federated learning is also called collaborative learning. So this really lends perfectly to what we're doing in ECHO. There is no PHI, so no case data ever contains PHI, right? We don't need to know who these patients are. We only receive the identified case form. So this is very similar to that. And so we built this framework to propose maybe how to share case-based learning across ECHOs, but that's not the only thing that this model can actually help us learn from, right? It can be used to track provider knowledge, to track provider engagement. We could look at performance trends across different sites, and this would help us then personalize continuing education as we go. So I guess, there are many benefits to using federated learning over the traditional data sharing. But the main one that I do want to emphasize is that no raw data is being shared, and the data always stays within each individual institution. So I think that's really the biggest lesson learned from how we could apply this model to ECHO. There are some technical considerations and some required infrastructure to build something like this. It is typically not outside of what you're currently using. Your current computer network can support. This is not big data by any means. So your current, computer network can handle something like this. But it would require still secure protocols and algorithms to be built. And so the only thing I want to say about this that's really important is having local capability for AI or computer engineering that can actually support something like this. And so that can be an opportunity and a challenge at the same time, right? Just making sure that there's an AI machine learning capacity that can support this at each ECHO hub, like I said. And possibly, coordinating across institution can be a challenge as well, just because there's so many different ECHO hubs and so that operate in many different ways. But we can overcome these barriers through institutional training, through grant support for pilot implementation that would, incentivize some of the ECHO hubs to participate in something like this by providing additional resources and space for them to build a machine learning and AI network. So, what can we do? How can we build this data network in the future? So federated learning can power a national ECHO learning network. It can support collaborative analysis of clinical and educational outcomes and development of AI tools across different specialties. And it can be really good to support research opportunities because federated learning can enable studies on ECHO curriculum effectiveness, participant behavior change, and equity in training outcomes, all without requiring direct access to sensitive data. So what can we do as a community? Well, I hope that we can support ECHO community to provide resources to build this federated learning infrastructure, to develop data sharing frameworks and pilot collaborative projects to accelerate cross-hub learning. And I have a few slides on that. This is not using federated learning in healthcare is really not that new. It's new in ECHO, but it's being used in healthcare. And so there was a systematic literature review that was just published last year that looks at how and who is using federated learning in healthcare. There's about 612 studies on this. But what I think is interesting that most of them still seem to be in a prototype platforms, still kind of developing their frameworks and using test data. There is about 20 studies using real life data. Most of them are on EMR and imaging types of data. And so finally, it's my final slides, but I wanted to provide some examples of if you want to learn more about how federated learning is currently being used. There are two really good studies, two really good projects that are sort of similar to what I'm talking about today. The first one is a UPenn website. I'm sure that they have a few publications, but the website is really, really good. So I wanted to share it with you, where they're using thousands of tumor MRI images to improve diagnostic accuracy across different institutions. And then the second study is using retinopathy images to help screen for diabetes. And so these two studies can provide a little bit more details about, how sites can contribute, how they participate, and what their particular role would be in data sharing. And the last thing I want to share is, although this is not necessarily a federated learning, it is a similar model. And the reason why it's not federated learning is because it's not tapping into PHI or any identifiable information. But you can think about CPOE, computerized provider order entry, as a model for something like this, right? So a clinician types in the computer, different symptoms, and they immediately start sort of getting messages on, look into this, have you considered this? That's very similar to what we're proposing, where we could tap into larger data set, get access, and build this knowledge, or even searchable database of cases or treatments, or, there's so many different options.
Thank you so much. Apologies, I had a little bit of a technology issue earlier. Are there any questions for Dr. Besovic? I didn't see any in the chat, but we will definitely you can also send questions that may come to mind afterwards to our email address. Haley can put that in the chat. So if there aren't any questions.
I have one, Molly.
Oh, perfect.
This is Rachel from the Missouri Telehealth Network, and I actually have the pleasure of working with Dr. Besovic. But this presentation was really, really good. Thank you very much. My question is, when you think about all of the ECHO projects that are ongoing, and there are just thousands of them at this point, when you're thinking about it, does every single topic have to go through a process of collecting the same data in order for this to be useful? So is it diabetes? Do people have to be collecting the same data? Or I know we're getting ready to start a cancer survivorship ECHO, so my question has to do with, you explained to us that it's a complex project that needs, a lot of people's buy-in, but I wonder, is it added to the complexity if for every single topic you have to have sort of exactly the same?
We don't have to have exactly the same type of data. I guess if you want to study a particular ECHO, then of course it's helpful. So we could study derm echoes across the country or the world, right? But if we're looking at provider engagement, or we're collecting data on, for example, case presentations or knowledge improvement through case presentations, or if the provider, we can look at hub team recommendations, for example, and see if participants apply that knowledge to subsequent cases. That doesn't necessarily have to be topic specific, right? So there are keywords and ways that we can extract information from different echoes and build a model that doesn't necessarily have to be topic specific. Thank you, great question.
Thank you. Were there other questions? Okay, well, thank you again for your presentation. It was really insightful, and we love having that next level of data knowledge regarding echo. Haley will also now share upcoming events, and we'll put a link in the chat for an upcoming registration for an upcoming webinar. In the meantime, as a reminder, we will email the recording and follow-up materials to you as soon as they have been processed. Again, if you'd like a certificate of attendance, please email us at the email address that has been put in the chat, htrc@kumc.edu. And we definitely look forward to seeing you all the next time. And please take a look at our upcoming events and register if you're interested.
Yeah, so we have just a few upcoming events we wanted to highlight. Through the Kansas City Diabetes, Obesity, and Nutrition Seminar Series, they're hosting Dr. Amanda Steano tomorrow at 12 p.m. So I just put the Zoom link registration in there for you all. It's going to be looking at harnessing screens to promote physical activity and healthy weight practices in youth. So definitely check that one out. And then coming up with the HTRC, we did have a bit of a schedule change with Rochelle Marding. We'll have her now on May 14th at 12, looking at critical telehealth updates and kind of that status of the financial package and all of the telehealth policy that comes with that. So definitely look forward to seeing you all there. And thank you so much for joining today.